through the last 18 months of us going through all of this, I think a big thing that we've learned is a family with a child with a chronic condition is just learning to advocate for ourselves, especially as parents who aren't medical professionals. There are times where we're not sure quite what you might have explained to us, or there have been times that we've presented at the emergency department and we maybe don't necessarily agree or understand with the actions that have been taken. Is there anything you can share with us about what we can do to advocate for ourselves if we're not sure or if we don't agree?
Okay, so I think I think the really key things are talking to the team that's involved as the key team. In New Zealand, there's also the option to liaise with one of the live-in nurses in Auckland as well as another point of contact. But linking in with the local team is one of the really key things. The hospital does have advocacy services, and for some people having that external person to help make their voice heard can be helpful. But I guess the really key thing is to be able to express and to voice concerns and voice what people are worried about.
Okay. Yeah, I think one of the things I discussed earlier with Sophie's dad was, especially in the early days when you're explaining, what Biliary Atresia is, it's a brand new thing for us, and not really being maybe necessarily able to process what that all means for us the first time you tell us about it. Is there any ways that we can get follow-ups or explanations maybe to be repeated or written out, if that makes sense? Or is that just something that we just need to be confident to ask the team for?
I think people will differ in terms of their confidence to ask, but I think the really important thing from our perspective is to be aware that this is a whole new field, a whole new lot of things that people won't be aware of. And as you know, I often draw pictures and try and explain things in that fashion, and leave the pictures, and then we can come back to them and add or clarify. And I try to make sure that when we're talking the second or the third time, that there's lots of time for questions or clarifications, and that's a really important part of things in terms of this is a learning curve, and it's not going to be an instant understanding and full comprehension of what might be happening now, but what the implications of that will be as well.
Okay. And I think another just key message or key question for families going through this is just even at more of a, base level, when we come in for things like blood tests or, there's something that we're waiting to hear from. So, for example, in those early days when we were running lots of tests and not waiting for results, what's a good way to contact you, contact our team? I think there was something that we weren't really sure of. Do we call? Do we email? What's the means of communication?
Sure. That will differ a little bit from centre to centre and from person to person, but in essence, there are lots of ways to get in touch and to contact. So sometimes it can be through the nurses, for example, in the outpatient setting. We have historically had a nurse that's had more of a role in terms of linking in with families like yourselves in the community. So one of the outreach nurses having a responsibility and a team role. And sometimes that can be an important way to contact. So through the outreach nurse or the nurse that's working in the community with people, with families. And then through the junior staff in the team can be another way to contact as well. And then, so sometimes email through the paediatrician or paediatric gastroenterologist is another way to contact as well.
Cool. I think as a family, we're never sure what the follow-up is. You know, when we went through a phase where we weren't sure when something happened, do we wait to be heard or do we make contact? So I think, again, it was just communication with the team of what works best with who we're working with.